Hello, today I will be discussing cervical cancer. The part that I will be discussing will be symptoms, signs, and diagnosis. So to start, what is cervical cancer? Cervical cancer is a growth of cells that start in the cervix, pass through sexual contact. When you contract and develop cervical cancer, you may not even get symptoms at first. This is because of the type of cancer. It takes years to develop. Cells are still abnormal, but the cells aren't affecting nearby structures. When the cancer does start to spread deeper, there are symptoms that do start to form. And with these symptoms, you will experience bleeding after intercourse, between periods, or after menopause. They can notice menstrual bleeding that may be heavy and have a foul odor. They can experience pelvic pain and pain during intercourse, and they can also experience watery discharge that may be heavy and have a foul odor. Unfortunately, a lot of women don't realize that they have cervical cancer because they either don't get those yearly checkups, or their symptoms are almost identical to what they are already experiencing before they even had the cervical cancer. So why do these symptoms occur? So before we talk about how these symptoms occur in the body, we have to understand what is happening on a cellular level. So what is happening is that the E6 protein binds to and destroys the P53 protein. This P53 is a major tumor suppressor, and without that P53, damaged cells don't die. E7 protein inactivates RB, the retinoblastoma protein. This protein helps to keep cells from dividing too fast. So we're having damaged cells that aren't dying, and then we're just having cells that are dividing way too fast in the body. So once we have this uncontrolled dividing and damaged cells don't die, then that's when the cancer will start to develop. And so for one of the symptoms, it's no symptoms. And the reason why that's happening is because those proteins are only staying on the surface of the cervix. There is no invasion or inflammation that's being penetrated into the cervix. There's also no nerve involvement. And so for our first symptom, why does abnormal bleeding occur? When the cancer cells grow, they form fragile, abnormal blood vessels. And then this is when the tissue becomes irregular and is easily damaged. And when it's easily damaged, it will lead to bleeding after sex, spotting, and post-menstrual bleeding. And then also, why do women get unusual vaginal discharge? When tumor cells outgrow their blood supply, it'll lead to cell death, which leads to dead tissue and bacteria. This gets broken down into the fluids, and that's how women will start to experience watery, bloody, or foul-smelling discharge. And then for pelvic pain and pain during sex, this happens when the tumor is growing and it starts to invade deeper into the tissues. And then this can lead to the tumor pressing on nerves, and it will cause a lot of inflammation in the cervix. So how do we detect cervical cancer? So a gynecologist will always recommend starting to get pap smears as early as 21 years old. And so what pap smears are, it's an early detection. They will look at the cells underneath a microscope to see if there's any dysplasia, which is pre-cancer cells. And so the results often are reported as atypical squamous cells of undetermined significance. What that means is that it will detect early HPV effects, and it also can detect irritation or inflammation. And so that's when we do a separate testing for HPV, which is in the pap smear. And so they'll see if the HPV is positive or negative. If it is a negative, they will still just do routine screenings to make sure everything is okay, since there is that irregularity. And then if the HPV is positive, they will do closer follow-ups with the pap smear and colposcopy to make sure that everything is okay, because usually cervical cancer will go away on its own. The second way that it can report on a pap smear is the low-grade squamous intraepithelial lesion. And so this is when there is active HPV infection. Changes are usually limited just to the surface of the cells. And so what they'll do is do monitoring, which is just more of those screenings closer together instead of waiting that year. Again, many of these cases usually just resolve on their own. And so the last report that can be shown in the pap smear is high-grade squamous intraepithelial lesion. So this is strong effects of HPV proteins. So that's going to be that E6 and E7 proteins that I was referring to. And so these are when the cells are rapidly dividing and they're very abnormal. And so we immediately want a colposcopy and a biopsy, and just so we can make sure that it is the cancer and we know what we're dealing with. And then that will possibly lead to removing those abnormal tissue. And what a colposcopy is, it is very similar to a pap smear in the beginning process of it. For the people who do not know, they do start off with a instrument. It's called the speculum. It's used to widen the vagina. For the pap smear, they do use a cotton swab to get a good sample of the cervix. It can feel uncomfortable for some, sometimes painful, just depending on if there are any UTIs or any infections in there already. But in this colposcopy, they use a colposcope to examine the vagina, the cervix, and the vulva. And they will see if there are any abnormalities. They'll use to map abnormal cells, see if there's any genital warts or polyps. And if there are any, they will go in with a biopsy for further laboratory testing to make sure what they're seeing in the test is accurate. Another way for cervical cancer detection is HPV testing. So this is basically DNA testing, and it will detect if you have high-risk HPV types, which is HPV 16 and HPV 18. The reason why this testing is detecting those strains specifically is because those two combined are responsible for 70% of cervical cancer cases. So this is a graph that I got from hpvworld.com that was posted in November of 2021, and it's showing that HPV 16 and HPV 18 are the two high-risk strains that will cause cervical cancer. And then I was talking about this earlier with the pap smear, but the other detection is the colposcopy and biopsy. So again, the doctors will examine the cervix with a magnification, the colposcope. They will use a substance called acetic acid, and it will turn any abnormal cells white, and then they will biopsy that tissue to see if any of it, to confirm if any of them are precancerous. So there are a lot of overlapping symptoms, even if you don't have anything, just the day-to-day of being a woman. Like sometimes you will experience some of these things. But with the other diseases, there are some overlapping symptoms with them. So you always want to do testing to make sure that you are accurately understanding what is going on in your body. So cerviticus. So with that one, instead of a pap smear, you're actually going to get a pelvic exam. And the difference between those is that the pelvic exam is more so looking at the organs. It's looking to detect any inflammation, redness, swelling, any yellow or green discharge, or easy bleeding when touched. And for the pap smear, it's more focused on the cells and any precancerous cells. And how they determine endometrial cancer will be transvaginal ultrasound. So usually if you have this type of cancer, your uterine lining will be a lot thicker. And so once that happens, you will get an endometrial biopsy. And so this sample will be a good diagnostic test to see if you have that cancer. Usually what they'll do is they look under the microscope and they'll see a lot of different changes in the cell tissue. They'll see large irregular nuclei, darker staining, loss of normal shape, and rapid uncontrolled division. And it does sound very similar to cervical cancer, but with endometrial cancer, it's more caused by hormones and mutations. The key driver is the estrogen exposure, so they will be seeing those biomarkers being the ER and PR, the estrogen and progesterone. Whereas cervical cancer is caused by HPV infection. And so for those biomarkers, P16 will be very uncontrolled, showing that it is that cervical cancer. And then for uterine fibroids, this is usually detected through ultrasound. They most times see it through this because you can actually see the fibroids on the uterus lining. With the ultrasound, they can detect the size, the number, and the location of the fibroids. And for detecting vaginal infections, they start off with a pelvic exam. And so what they're looking at is the vaginal walls and the cervix, and they will check for redness, swelling, and types of discharge. And then they will then go in with a vaginal swab. And this is very important because the collection will test for vaginal candidiasis, bacterial vaginosis, and trichomoniasis. And what these are is the vaginal candidus is a fungus, the bacterial vaginosis is a bacterial imbalance, and the trichomoniasis, that is a parasite. So with all of that being said, and to all my women out there, it is so important to get your annual pap smears. You always just want to know what is going down there, even if you're not having sex, even if you know that your partner is clear, you just never know what is happening down there. And the best way to know is to check. So this graph was taken by the North American Association of Central Cancer Registries, and it's showing at what age a lot of women were diagnosed with cancer. As you can see, as it gets to that late 30s to 40 range, that a lot of women are developing these cervical cancers. And so that really does show that the cervical cancer takes a lot longer to show symptoms, to really develop into something serious. But it also shows that it's not impossible for someone as young as 20 years old to get cervical cancer. And so this really does emphasize that no matter at what age you need to take preventative care. You need to make sure you're doing your testing to ensure everything is okay down there, and so that they can treat it before it gets serious. So yes, make sure you get your annual pap smears. And yes, thank you for watching my presentation.